Final exam. Please answer the test questions to the best of your ability. There will be multiple choice and true false. You will only receive one attempt to take the test. Once you start the test, you must complete it. Question 1. Which of the following answer choices would not be considered a risk associated with taking performance-enhancing drugs? Infections/bloodborne disease, aggressive behaviors, severe acne, osteoporosis. Question 2. A blank is an unrealistic or overwhelming fear of some object or situation. Phobia, GAD, OCD, or PTSD. Question 3. Drugs that alter perception, awareness of surrounding objects and conditions, thoughts and feelings are called what? Hallucinogens, performance enhancing, depressants, or stimulants. Question 4. Users of blank have a much greater risk of contracting HIV, hepatitis B and C, IV, injection drugs, smoke drugs, inhalant drugs, or digested drugs. Question 5. Blank is a pattern of excessive, unrealistic worry about not attributable to any recent experience. Obsessive compulsive disorder, generalized anxiety disorder, phobia, or panic disorder. Question 6. Which of the following is not a side effect of fetal alcohol syndrome, FAS? High body weight, abnormal facial features, speech and language delays, poor coordination. Question 7. Blank is terrifying panic attacks that include physical symptoms such as rapid heartbeat and dizziness, panic disorder, post-traumatic stress disorder, eating disorder, or phobia. Question 8. Athletes who use performance-enhancing drugs will likely be eligible to participate in all unorganized sports. True or false? Question 9. Blank is a pattern of flashbacks and other symptoms that occur in children who have experienced a psychologically distressing event such as physical or sexual abuse, being a victim or witness of violence, or exposure to some other traumatic event such as a bombing or hurricane. Phobia, tic disorder, schizophrenia, post-traumatic stress disorder. Question 10. Blank is a disorder that involves disordered perceptions and thoughts. Panic disorder, post-traumatic stress disorder, phobia, or schizophrenia. Question 11. Blank involve intense emotions and attitudes as well as unusual behaviors associated with weight and or food. Schizophrenia, tic disorders, phobia, or eating disorder. Question 12. A school nurse, a pastor, a hotline, crisis hotline, or teacher can all be examples of places/people to get help from in the case of mental disorder. True or false? Question 13. The effects of anxiety can include accomplishing goals, maintaining good grades, better health, and positive relationships. True or false? Question 14. People do not need to get help with mental disorders immediately because they eventually will go away. True or false? Question 15. A stressor can either be positive or negative to a person. True or false? Question 16. A combined problem of poor diet, physical inactivity can attribute to communicable diseases, chronic disease and obesity, none of the answer choices, or sexually transmitted disease. Question 17. Iron and blank are essential components to a pregnant female's diet. Creatine, protein, folic acid, or none of the answer choices. Question 18. An athlete or someone who is very active should consume blank calories a day versus a non-athlete or someone who is not active. More, the same, no, or less. 19. Which of the following is not a source of energy for the body? Carbs, water, protein, or fats? Question 20. Which is a symptom of bulimia nervosa? Avoiding food to the point of starvation, having an extreme low body weight, using laxatives to remove food from the body, or eating very small amounts of food. Question 21. To lower the risk of many health problems, teens should aim for how many minutes of physical activity every day? 30 minutes, 20 minutes, 60 minutes, or 45 minutes? Question 22. Which choice is an intense exercise that involves short bursts of activity in which the muscles work so hard that they produce energy without using oxygen? Flexibility exercise, aerobic exercise, anaerobic exercise, or cardiorespiratory exercise? Question 23. Blank vegetarians only avoid red meat but eat fish and poultry along with fruits and vegetables. a vegan, lacto-vegetarian, semi-vegetarian, or a lacto-ovo-vegetarian? Question 24. Vegetarian eating plan includes mostly or all plant-based food, includes all the required amounts of B12, consists of only nutrient-dense foods, increases your chance of cardiovascular disease. Question 25. Adequate hydration is required for all of the following except bone growth, waste removal, joint lubrication, or blood volume. Question 26. The 5 major food groups according to my plate are grains, green vegetables, milk, protein, and fruit, grains, vegetables, dairy, fruit, and meats, grains, vegetables, milk, fruit, and beans, or grains, vegetables, dairy, fruit, and protein. Question 27. A blank is a unit of heat used to measure the energy your body uses and the energy it receives from food. Is it Celsius, temperature, base, or calorie? Question 28. What are the 5 elements or the components of fitness? Is it flexibility, body composition, endurance, stamina, and speed? Or stamina, body composition, speed, muscular strength, muscular endurance? Muscular stability, muscular endurance, flexibility, body composition, and cardiovascular endurance? Or muscular strength, muscular endurance, flexibility, body composition, and cardiovascular endurance? Question 29. The benefits of exercise are only physical. True or false? Question 30. People of all ages can follow the same suggestions for the amount of calories they take in daily. True or false? Although blank is legal in some states, it can have a number of side effects, including altered senses, change in mood, difficulty thinking and problem solving, lower IQ, and impaired memory. Bath salts, opioids, heroin, or marijuana. Question 32. When prescribed by a doctor, blank can be helpful for treating many illnesses. However, when they are misused, they become deadly. Cocaine, prescription medicines, heroin, or methamphetamine. 33. During pregnancy increases the risk of health problems for developing babies, including preterm birth, low birth weight, and other birth defects. It can also increase the chance of SIDS, sudden infant death syndrome, taking folic acid, an unhealthy diet, exercise, or smoking. Question 34. Moving a victim is dangerous to a seriously injured victim. A victim should be only moved if the scene is unsafe, the victim has a fracture, the victim has loss of feeling in their legs, or the victim has loss of feeling in their legs. Question 35. Possible concerns from receiving a body piercing, which include which of the following? Keloids, all of the above, all answer choices, scars, or blood-borne diseases. 36. What is the most frequently diagnosed skin cancer in the U.S.? Melanoma, squamous cell carcinoma, basal cell carcinoma, or border? 37. An annual physical examination are examples of what type of control method? Secondary, tertiary, none of the answer choices, or primary? Question 38. When riding an ATV, all of the following should be worn except tennis shoes, long pants, DOT helmet, long sleeves. Question 39. All of the following characteristics that increase individual risk for melanoma except being male, fair skin, light hair color, heredity. Question 40. Hypertension, atherosclerosis are both categorized by what type of chronic disease? Cancer, heart attack, emphysema, or cardiovascular disease. Question 41. A condition in where there is a progressive bone loss of tissue called what? Hypertension, bronchitis, cardiovascular disease, osteoporosis. Question 42. Which of the following would be considered a tertiary control of disease? Self-examinations, the testicles, self-examinations of breast, chemotherapy, or checking cholesterol. Question 43. If you decide to donate organs, you should all answer choices, register to donate at nclife.org, say yes to donation when you get your NCDL, Let your family know your wishes. Question 44. All the following body parts or organs can be donated except an arm, a kidney, a lung, or intestine. Question 45. Primary prevention includes having a good diet, exercising regularly, and avoiding things like blank to keep disease or injury from happening. Sunscreen, wearing a seatbelt, wearing a helmet, or tobacco. Question 46. Cancer is an uncontrollable growth of abnormal cells. True or false? Question 47. PRICE stands for Protect, Rest, Ice, Cold, and Elevate. True or false? Question 48. The first step in the decision-making model is to identify the decision that has to be made. True or false? Question 49. Which of the following answer choices is a powerfully addictive stimulant made from the cacao plant? Cocaine, marijuana, heroin, or MDMA? And then question 50, Molly or ecstasy is street names for blank. A drug that alters mood or perceptions, which is it heroin, cocaine, bath salts, or MDMA? Please submit the quiz when you are finished.